Science has presented us with a hope called stem cell research, which may provide our scientists with many answers they have for so long been beyond our grasp. I just don't see how we can turn our backs on this.
On May 24th, 2003, I gave birth to our third child, Hannah. She was born in perfect health. Then, at the age of 3.5 years, Hannah's world was suddenly turned upside down. While playing with her grandfather, she lost consciousness and suffered a series of seizures. She was rushed to the nearby hospital with a life-threatening condition of repetitive, unexplained seizures, preventing the ability to breathe. The next 3 months proved to be a living nightmare for our entire family. Hannah was admitted to the hospital for a total of 41 days with uncontrolled seizure activity. She had lost her ability to speak, to walk, to control her bowels or bladder, to interact with others, and even lost her ability to recognize mom and dad. Neurologists tried in vain to stop her seizures. We were told that Hannah was suffering from idiopathic Lennox-Gastaut syndrome, a severe and incurable disease. I asked the doctor if there was any chance that she could recover. The answer was no. I cried and hugged the neurology nurse and said, "What do we do now?" She said, "Take her home and enjoy her. This is going to get very bad very quickly." We promised ourselves and our daughter that we would travel to the ends of the earth and back in an effort to help her. We scheduled her treatment for June 30th, 2007. Within 20 minutes following the treatment, Hannah began to roll her head from side to side and started to cry. She was looking around the room as if she was totally lost. I was terrified. My husband took her in his arms and said, "You are okay. Daddy and Mommy are here." She looked at him and said, "Daddy, why did you wake me up?" She was reassessed by medical professionals and was found to be cognitively age-appropriate.
I'm having fun in school.
Today, Hannah is attending a regular kindergarten and is doing very well. She rides a bike.
I'm doing great!
She drives go-karts. She swims, sings. Runs, jumps, everything that any 5-year-old could and should be doing.
Look, there's Mommy taking a picture. Look, there's
Woohoo! Her quality of life has improved 100%. We will be forever grateful for the gift Dr. Rader has given our family.
I love you, Dr. Rader.
Dr. William C. Rader is the only American physician involved in the clinical application of human fetal stem cells. Since 1995, he has successfully treated more than 1,500 patients. Dr. Rader earned his medical degree with honors from the State University of New York at Buffalo in 1967. While serving as chief psychiatrist for the U.S. Navy's alcohol treatment program, he developed a widely used training program for alcoholism counselors. He is recognized as a pioneer in the fields of drug addiction, eating disorders, sexual addiction, and most recently, stem cell clinical research.
Hello, my name is Dr. William Rader. I'm the only doctor in the world, actually, that is doing the kind of work that I'm doing. And I've been doing it for 15 years, and I've treated over 1,500 patients. What's unique about what I'm doing is that I use fetal stem cells. There's a confusion. Most people think that an embryo and a fetus are the same thing. They're not at all. An embryo is simply 5 days old and a ball of cells. A fetus is between 8 and 12 weeks old, and it's the size of your pinky fingernail. This allows us to actually take cells from the fetus, which you can't take from the embryo because they haven't developed into anything yet. Cells such as brain cells or blood cells. And these cells are incredibly powerful. And their whole agenda is repair and rejuvenation. They look at you as if you're a large fetus with a lot of problems. And then they go to the areas of damage, they do repair, or they even develop new cells. They're capable of being any type of cell in the human body.
At 4 a.m., Elizabeth Badalamenti delivered her son Luca. What is supposed to be a moment of celebration quickly became a mother's worst nightmare.
I hear a knock on the door, and it's the pediatrician. So she comes in, and she introduced herself, and she said, well, we have, some concerns that Luca was born with Down syndrome. I was so afraid. Afraid that, as a mother, what do I do with a special needs child? I wasn't educated. I didn't know the first thing. I researched all I researched. My gut feeling said, there's nothing else out there that could possibly help my son. As long as it can't hurt him, that there's going to be no side effects, I'm not going to let this chance pass us by. And my husband agreed. He says, I don't want to go through life wondering, what if?
After some extensive research of her own, she called Dr. Rader, who administered fetal stem cells to Luca with positive results.
Especially with everything we're hearing the stem cells are doing.
Within, I'd say, an hour or two, his behavior started to change.
He woke up. He was alive in his eyes. And that's the only way I could explain it. Here was this little boy that, up to this point, just had kind of like a stare. After the second treatment, I called Dr. Rader. I said, I know you're going to think this is crazy, but Luca's head's changing. That typical flatness that children with Down syndrome have. They have a very flat forehead and a flat bridge of a nose, and typically the back of their head all tends to be flat, is rounding. There is something out there that could help. Give people the door, open that door for them, let them know, let them be able to do their own research and let them make the decision whether this is something for them or not, just to let people know that it's there. I never knew it was there. And I know that my child went down there being one personality, and within 24 hours was a completely different child. There is no other explanation other than the stem cells. There's just no other explanation.
If you had a child that had this illness, you wouldn't care what the politician says, what the scientist says, what the doctor says, what the religious right says. You will bring that child and you will tell everybody about it. That's all I want. I want people to know that this treatment exists.
I was fine until I was 2.5 years old, and then I started getting really bad migraines.
We did everything we could to try and get treatment for him. We took him to various doctors, to hospitals. There's nothing out there for children with migraines.
I'd be vomiting, I'd be crying. I couldn't even make it to the bathroom because it was so bad, so I had to use a bucket right next to my bed.
This particular day, he just kept vomiting, and he kept vomiting, and he was screaming in pain, and he said, Mommy, I just want to die. And I just cried because I didn't know what else to do with him. When I just prayed and prayed and prayed and prayed for an answer. And I finally got one.
It was amazing when I got the stem cells because I felt so much better and my headaches weren't here anymore.
It was almost immediate. I mean, he felt good right after the treatment and has since stayed that way.
I can actually go around and just like do normal stuff, just like not have to worry about laying in bed and being sick.
I felt like God intervened and answered my prayers because I was praying for some kind of miracle for my child. And I definitely feel that God was watching over and helping him and guided us to the stem cells, Dr. Rader helping us. I mean, it is a miracle, and I definitely feel that my prayers have been answered.
Mark suffers from cystic fibrosis, a life-threatening disease with no known cure. His parents were told after countless failed treatments by his doctor, if they discontinued those treatments and brought Mark to see Dr. Rader, he would surely die.
We went to see his lung pulmonologist on his lungs and to check him and just see how he's doing. And we got into a 2-hour battle in her office because we were going to go to do the stem cells with Dr. Rader on, and she basically raised all hell at us because we were bad parents and we shouldn't be doing this, and I went back and forth with her saying this is what we want to do. He did the treatment, and that what he said to you guys was his first treatment.
I could totally breathe better, and it was like a wet washcloth just removed from my face.
If you saw him
Laboring.
his pulse was 150, sitting in a chair. I can see a huge difference.
Watching him not labor.
He was do his labor.
I'm not coughing, and when I came in here, I was on oxygen. Now I'm not. I could breathe better. I feel like I have more energy.
Mark was in a hospital. They told Mark that he was probably going to die. He was severely ill. After Mark's successful treatment, as you can see, he gained all that weight and is playing golf and doing well. And the hospital is still writing letters to Mark's parents saying, bring him back. He must be at death's door. And they have not told these people that most probably, if they hadn't released him from the hospital, that he could have died there.